What is spinal cord injury? Spinal cord injury is a traumatic damage to the spinal cord or nerves at the end of the spinal canal. A person with damage to the spinal cord may suffer from loss of sensation and motor function depending on the level of severity of injury. Damage to the spinal cord can be caused by fractures, compression, or disease. What are the two types of spinal cord injury? Incomplete lesions. Not all nerves are severed or nerves are only slightly damaged. Most of the spinal cord injuries are incomplete. Recovery is possible but never to pre-injury level. Complete lesions. The nerves are preserved and there is no motor or sensory function preserved at this point. What are the causes for spinal cord injuries? Motor vehicle injuries, falls, sport injuries, violence, self-harm, work-related accidents. Initial evaluation of the spinal cord injury includes loss of ventilatory functions, signs of hemorrhages, traumatic paraplegia caused by lower thoracic lesions, quadriplegia associated with cervical level lesions. What are the complications of spinal cord injuries? Problems with bowel and bladder function, respiratory difficulties, spasticity, neuropathic pain, muscle wasting and weakness. What equipment is used in diagnosing spinal cord injury? In diagnosing spinal cord injury, MRI scans is standard for imaging neurological tissues. Spinal fractures and bony lesions are better characterized by computed tomography scan, CT scan, and vascular injuries can also be detected by CT scan. What are the physiotherapy management of spinal cord injury? Physiotherapy management of spinal cord injury can be divided into three phases: acute phase, sub-acute, rehabilitation phase, chronic long-term phase. What happens in the acute phase? In acute phase, physiotherapy management is predominantly involved in prevention and management of respiratory and circulatory complications and minimizing the impact of immobilization such as pressure ulcers, contractures formation. What are the treatments in acute phase? Strengthening exercise to maintain and strengthen all innervated muscle groups and reduce muscle weakness. Resistant training involves improving muscular strength. Range of motion exercise for maintaining the full range of movement of all joints within the limitations determined by the stability of the fracture. Muscle stretching below the level of injury to help muscle lengthen, reduce stiffness and forming contractures. Practice breathing exercise to facilitate ventilation. Correcting posture and positions to prevent forming pressure ulcers. Exercise to improve balance, support and educate the patient, family and staff. What happens in the sub-acute phase? Sub-acute rehabilitation phase is mainly focused on improving quality of life of the patient. Most common physiotherapy intervention is transferring, especially for paraplegic patient, followed by range of motion, stretching and strengthening exercises. What are the treatments in sub-acute phase? Strengthening exercise, balance training, gait training, improve cardiovascular fitness, pain management. What happens in chronic long-term phase? Long-term phase is mainly focused on achieving high-level mobility goals required for community participation and monitor the recovery of function.